Understanding the difference between depression and obsession. Depression and obsession are very different conditions, and a therapist has to differentiate between the two. Obsession occurs when a person builds up a mental model of life that is completely hopeless and makes it seem like there is no way out. They rationalize retreating from their environment or becoming motionless and do not see any motivation to stop. While both are debilitating and difficult to deal with, they are related. In order to identify which one a patient has, a therapist will first have to determine the causes of the obsession. Serotonin imbalance. Serotonin is a neurotransmitter produced by the serotonergic neurons of the brain. When serotonin levels are low, depression and obsessive behavior may occur. When serotonin levels are too low, a person may feel depressed, or even suicidal. Serotonin deficiency can also affect one's self-esteem and memory. The body produces serotonin in small amounts, which can lead to symptoms like panic attacks or anxiety. The brain uses serotonin to regulate mood, sleep, appetite, and even blood clotting. In addition to affecting mood, serotonin is also involved in appetite, bone health, and blood clotting. It is also responsible for regulating sexual desire. Serotonin plays an important role in mood, appetite, and sleep, and can be depleted in certain people. Serotonin is essential for life and may be found in high concentrations in people with depression, anxiety, and obsessive-compulsive disorders. Stressful life events. There is some evidence that stress are associated with depressive and obsession symptoms. Stressful life events include death, divorce, and loss. They may also contribute to the severity of OCS. Although these associations have not been proven conclusively, they are consistent with other evidence. Researchers in Sweden have used multiple regression models to examine the role of stress in causing psychiatric symptoms. While the study results are not definitive, it does suggest that certain stressors may contribute to the severity of depressive and obsessional disorders. Researchers have long noted a link between stress and major depression. Genetic studies suggest that certain stressful life events are associated with an increased risk of major depression. Unlike other factors, stressful life events can be hereditary. Some people tend to choose high-risk situations, which may predispose them to major depression. A study of twins found that the risk of major depression and obsession were significantly related to a stressful life event. Cognitive behavioral therapy. The goal of cognitive behavioral therapy for depression and obsession is to change a person's thoughts and behaviors. CBT is action-based, and helps patients identify problem behaviors and build self-esteem. Cognitive restructuring can help a person identify and change negative thought patterns and learn to rationalize them. There are several behavioral techniques employed in CBT for depression and obsession. These techniques are based on the theory that the mind is a powerful tool for self-improvement. CBT is most effective when the symptoms are mild to moderate. It is effective for a variety of mental health conditions, and requires a commitment of time and a willingness to undergo change. It can also be combined with other treatments, such as medication and psychotherapy. While CBT can be effective on its own, it may not be the best solution for everyone. Therefore, it is important to seek advice from a medical professional before undergoing CBT for depression and obsession. Medication. Medication for depression and obsession may be prescribed when a patient cannot use CBT alone. However, some experts recommend using medications to treat OCD during pregnancy. In these cases, SSRIs are preferred over clomipramine. Other medications that may be used include neuroleptics. They may also be prescribed to reduce tics. However, you should consult with your healthcare provider before taking any medication. The following are some factors to consider when choosing a medication. SSRIs are common and well tolerated by most people with OCD. They cause nervousness, sedation, and insomnia. These side effects typically subside as the body adjusts to the medication. Taking these drugs may result in sexual dysfunction and weight gain. However, the long-term benefits of SSRIs far outweigh any negative effects. There are 4 SSRIs approved by the FDA for the treatment of OCD.